And we're going to talk about phage. That's Phage. Many of you may already be familiar with these products. We have 4 of them actually in our product database. They're very applicable in many different ways that we would like to highlight today. So there's Ecovirum, there is Salvirome, Pseudomonas, and also Skinvirome, which is a recently developed product. I'm going to let Dr. Shayne here elaborate a little bit more on how phage works and how these products can be applied for your patients.
So briefly, I want to give you a quick background on phage, because phage are an amazing tool, and you can think of them as part of the microbiota in general. We have literally trillions of phage on us, in our water systems, in our oceans, and they're there to help provide an additional level of benefit to our microbiota. Now, I'm going to give you a demonstration of what they look like. So imagine this is a bacterium. This little creature right here that looks like a lunar lander is a phage. What phage do is they directly attack a given species of bacterium. They enter the bacterium and they destroy it. The uniqueness with phage is they can control populations of bacteria specific to the phage. So as Mike mentioned, let's talk about Ecovirum. Ecovirum is an E. coli-based phage, which means the phage in that cocktail are directly targeting E. coli species in the body, which is good because we've already learned through many anecdotal as well as many European studies that having E. coli phage at your fingertips can help control UTI impacts of E. coli, can help control gastrointestinal impacts of E. coli. And there are some recent publications that show the ingestion of E. coli phage helped repopulate the microbiota of the gut and create diversity, because E. coli can easily become a dysbiotic organism taking over the gut. What are the benefits? Less diarrhea, less bloating, less cramping. There were many indications that were improved by the E. coli phage. Now, the other one that's found mostly in Europe is the UTI component. So specifically the female UTI. About 80% of UTIs tend to be E. coli based, which is why we talk about that quite often with UTI patients and young women. So that's E. coli phage. The next one is Salmonellophage or Salvirome. And the Salmonellophage, although not as commonly used for health indications, because that is clearly a pathogen, where we like to tell people to use that is on organic produce or organic farming or anything where there could be a possibility of Salmonella breaching the food chain. You can spray this phage on there and it helps bring it down. There may be unique applications in your own practice for Salmonella, but typically speaking, what we see is it's a preventative or prophylactic phage for most indications. Because even in humans, Salmonella doesn't persist like E. coli does. E. coli will live within you for a while. Salmonella doesn't usually do that. So that's how we use Salmonella. The next one is the pseudophage, Pseudomonas originosa. So Pseudovirome has a phage against the Pseudomonas organism. And Pseudomonas originosa is, again, it's not a friendly organism. It's an organism that takes advantage of dysbiosis. The phage helps you control that overgrowth or that population change because it targets just Pseudomonas aeruginosa. And it does that by controlling the growth, as we showed in the little detail. What's it good for? Well, clearly Pseudomonas aeruginosa can be a skin problem. It can create infections of the skin. It's what people get after they sit in a contaminated hot tub. It also has implications in the GI for leaky gut and blood glucose concentrations. So use Pseudomonas aeruginosa phage or the Pseudovirome when you have skin dysbiosis or gut dysbiosis. It can be very helpful, like the Ecovirum. Finally, we have the Cutibacterium phage or the Skinvirome. That one has 2 applications as well. Skin is another one. We like to control the acne on skin or other inflammatory issues. And so we apply this skin phage, and we've already seen anecdotal studies. Finally, we've now learned that it can be implicated in inflamed prostates. So for men that are aging or otherwise experience inflammation in their urogenital, the Cutibacterium acnes or Skinvirome may be a tool that you can go to. So please look into that.
So you found some fascinating golden nuggets and clinical applications about each and every one of these 4 phage products. For further questions that you have, please feel free to post below any of those questions and we'll address those. Thanks for joining us.